Vaccine distributions are expected to continue throughout this week in hopes of bringing down the number of cases. While some frontline workers have already taken the shot, some healthcare workers will opt out. A San Antonio nurse who worked on the front lines in New York, Houston, El Paso, and in San Antonio is choosing to wait to get the vaccine. The Night Team's Tiffany Huertas tells us why.
I'm not saying that I'm against it, but I'm kind of holding off so I can see, what the outcomes are.
As healthcare workers receive the first doses of the COVID-19 vaccine in San Antonio, registered nurse Shirley St. Louis won't be getting it this week.
You have some nurses and some healthcare professionals that just feel like this vaccine was expedited way too fast, and we just don't know too much about it.
But not everyone feels this way. Dr. Kenneth Kemp joined us for our live stream on vaccine last week. He explained the technology to develop a messenger RNA type of treatment like this vaccine uses has already been investigated for more than a decade. Researchers also had a head start since this virus is very similar to other coronavirus outbreaks we've seen in the past, like MERS and SARS.
As soon as it broke out in China, and experts from China began to isolate the S protein or spike protein of the new coronavirus, researchers across the world sprung into action. And so, yes, it happened quickly, but it also happened in a way that built upon previous studies.
Infectious disease specialist Dr. Ruth Berggren received her shot today.
I am proud that I get to be one of the first people. I am feeling very privileged and honored, and I hope that everybody sees that I'm smiling. I barely felt the needle. It was no different than getting a flu shot at all.
The FDA determined that the potential benefits of the vaccine outweigh the risks. Berggren agrees.
I have reviewed the safety data, and we're just seeing, mild vaccine reactions, little headache, little sore arm. After the second injection, maybe some fever, maybe a little worse achiness after the second injection.
Even though the Pfizer vaccine received emergency approval already, it doesn't mean the clinical trials are over. Participants will be followed for 2 years to track any side effects. Tiffany Huertas, KSAT 12 News.
Tomorrow, San Antonio Veteran Affairs is set to vaccinate its first employee and veteran. It will happen at the Audie L. Murphy Memorial Veterans Hospital at 9 o'clock in the morning. The Pfizer COVID-19 vaccine was already administered at Joint Base San Antonio Lackland. Brooke Army Medical Center and the Air Force 59th Medical Wing were among the first to receive shipments of the vaccine. The first shot was given yesterday to Major Andrew Gauspole, an Air Force doctor.